As the people of Acholi sub-region in northern Uganda strive to rebuild their lives from the Lord's Resistance Army (LRA) insurgencies, access to clean and safe water remains a challenge. According to the UN Refugee Agency (UNHCR), nearly 92% of internally displaced persons in Acholi sub-region have now returned to their communities of origin or settled in a location closer to their homes. They, however, face challenges accessing basic services such as safe water, health service, and education. The existing facilities and general services available to these community members are not adequate to meet their basic needs. Access to water in Uganda is defined as having water from safe water sources within the range of 1.5 kilometers. In Gulu district, access to safe water stands at 6.4%. But over 300 water sources were decommissioned in 2012 as these sources had been constructed during the insurgency in the IDP camps. Therefore, a lot of people still spend valuable time in search for safe water, thus reducing the time to work on economic activities and children attending schools.
One no man no food pay to the pin or mar with pima rojo. They were oigan quan late people. Eh man don't to you pima laying, don't want mar pima laying, pay or mar pima rojo.
Similarly, many households do not have adequate sanitation facilities and do not practice proper hygiene. Access to proper sanitation in Gulu district was calculated at 66% for latrine coverage and 10.4% for hand-washing facilities as of June 2012. World Vision Uganda, with funds from World Vision Korea, is implementing a one-year project in Omoro sub-county to reduce the morbidity and mortality of water, sanitation, and hygiene-related diseases in Omoro Area Recovery Project.
Our program in Omoro started in 2011. At that time, communities were just returning from IDP camps into villages of origin. At that time, water and sanitation situation in the areas of return was very poor. Sanitation coverage alone was 47%, and water coverage was 42%. Out of our programming in the last 3 years, we've been able to increase this sanitation coverage to 63% and water coverage to 67%. We have also been able to support communities to improve hygiene by sensitizing them through the CLTS approach, and then they are now able to sustain the hygiene promotion in their communities. And with that, we have been able to declare 7 villages open defecation free in Omoro.
Ikarma wel bi jon pia kele wo pi ne wo mar la gure matikil miata bi ma wa le pi eni wa ke diang be mar wan watika mato. Ikarma wo mar pi eni no watiki tuo ma pol mai tuo cherugi ma yelu lutiana wo wan lu dir weng mak no wa no yat e kar ki kar e ko beri kar ni ma don wel bi jon kele wo pi don wati mar pi ma bejo don tuo ni ki weng don wa jwayo don pe.
Behind me, as you can see, these are community members of our Walcock village. We supported them with one deep well, and towards sustainability and operation and maintenance of this water source, they have opened up this garden to help them generate some money that they will keep in case the water breaks down. They will be able to use this money after selling what they have grown from this garden. So that money will be used to repair their borehole, to make sure that this borehole sustainability is okay and takes maybe longer period until even other children uses it.
And many hours in man parba one group me wang pi but mabati la mi pabo. Parna eni gwana eni mo wa charo mo wa chuli chiana ko ten gang kwam mo wa yubo ki pi mo ko luak dano ke nyai wi ko nyi yanyi.
And in the past the water coverage, the percentage was about 19%. The water coverage in Lakwana sub-county, but at the moment as I talk, the percentage has gone up to about 67%, and as a result of this, waterborne diseases actually it has reduced, and in the past it was serious. People were suffering from these other diseases from the water, like bilharzia, trachoma, and so on. So these days, It is not there. And really, I think they have done something wonderful.
By the end of September 2014, the project would have contributed to increased sanitary access to safe water supply and sanitation, and people would be practicing good hygiene in targeted communities.
Looking at the baseline being below 20%, and then when we're starting this project, we are privileged that we've moved beyond the baseline to about 65% coverage in Omoro sub-county or Omoro county as a whole. But this is not the indicator in other locations in Acholi sub-region or in Gulu particular where we are operating. A number of locations are still underprivileged because development partners are not reaching out. Some of the far distant sub-counties are not being reached by development partners because of administrative costs. And so it's our prayer that such opportunity is extended to some of those locations so that our vulnerable children also benefit from this opportunity. We'll be very grateful to see Korea continue to partner with us and continue to support us in the future years so that we reach out and achieve the child well-being outcomes that World Vision dream and admire to contribute for the people of Acholi that has been highly affected by the Konyu War for the last 20 years. Thank you very much. We are humble.
The project provided functioning drinking water supply systems in Omoro Area Recovery Project. 8 deep and 2 shallow boreholes were drilled and 6 deep wells constructed. These are supplying safer water to 1,800 persons in 6 villages located across the 3 sub-counties of Omoro Area Recovery Project. 6 out of the target 14 WASH committees have been established and trained in financial management, operation and maintenance, and hygiene and sanitation. The committees consist of 10 elected committee members composed of 5 women, 4 men, and 1 co-opted community administrative leader. The main role for these committees is to ensure proper management of the water source, collect and manage funds for the repair and maintenance of the water source, and to carry out hygiene promotion among fellow water users. Following the training, each WASH committee has mobilized their respective water users to fence the water source, a mechanism of keeping away wild and domestic animals from contaminating and damaging the water source. WASH committees have been trained in WASH-related environmental protection and management, hygiene and sanitation, and operation plus maintenance.
Alikuwa sote timu yangu.